Hello, everyone. Um, my name is Nehal Desai, and just going to quickly look over this section on um, gastrointestinal tract infections. Um, one of the most common one that is important, especially to know, is uh, particularly on H. pylori infections. Now, H. pylori is an infection that can um, occur in usually in the stomach area and cause a various um, uh, well, it actually can cause really severe ulcer in the stomach. Um, so typically, it's caused by someone who has peptic ulcer disease or who has had a um, who has been having like a got in contact with contamination, whether it's through food or fecal or anything like that. And typically, when it's ingested, it goes through the blood and it gets into the stomach and then leads to um, ulcers. And so, um, typically, when there's an infection like this, um, there's more than one antibiotics that would be used to treat this infection. Plus, you may have a couple other medications and combination for this treatment. So in this review, I'm just going to go over some basic information on how an H. pylori leads to the infection, and then how it can be treated. And there is one diagram I drew, which I hope will make it a little bit easier for you guys to look at as you analyze the treatment options um, when um, treating this particular type of infection. Sometimes in a pharmacy, you may see like certain patients that come to look for an over the counter heartburn medication. But sometimes those heartburn medications are used to treat other disease states too, not just heartburn itself, but sometimes patients have to use it to treat some gastrointestinal ulcers or things of that nature that is part of the combination of antibiotics that is needed to treat that type of infection. So in this um, review, I'm going to talk about those specific type of antibiotics and how they actually work, so you can see how it will prevent or treat or work against the bacteria that infects that area of the body. So let's take a look. So as I mentioned earlier, previous sections, these are typically like the different um, infectious diseases you might have encountered um, as you were looking at in the previous videos. So in this case, in this presentation, I'm just going to talk about the upper gastrointestinal infections portion of it, which is a commonly studied um, type of infection for, especially when it comes to studying for the exam, and especially when you're in practice and you see patients looking for a medication used to treat that type of infection. If you have to give any recommendations to any doctors or physicians or any other um, healthcare provider, at least you would have an idea as to what type of medications are used to treat this type of infectious disease. So it's important to know this as well. Um, so let's take a look. So this is just a definition to show that it's also known as gastroenteritis and can be caused by bacteria, viruses, and parasites. So there's not just one type of infection that's caused by one type of bug. There could be other types of bugs that cause um, gastrointestinal infections. Gastrointestinal infections is a broad term, but in this presentation, I'm just going to specifically talk about the one part of the infection. In the future presentations, we'll probably look at the other types of infections that might occur in when it comes to the gastrointestinal tract. So let's take a look at how H. pylori works and how that's treated. Typically, in all the types of gastrointestinal infections, you might encounter things like diarrhea, nausea, vomiting, which are the main three type of symptoms that are known to occur even while on medications. But this is also very common when it comes to the GI tract. There could also be some stomach aches or abdominal pains, cramps, fever, fatigue as well. So these are very common symptoms that are likely to occur, especially when having to deal with this type of disease. So it's important to know that. So like I mentioned, and we're going to just mainly to focus on the H. pylori, which is specific bug. It basically weakens the protective mucus layer and then leads to ulcers. So if you look at the diagram here, you can see how the H. pylori is basically has its own adhesive molecules and it's binding to the receptor, so it can kind of allow the bug to bind into the stomach and go right into the stomach and cause very severe ulcers. So typically this is caused by someone having peptic ulcer disease, chronic gastritis, gastric cancer, anything of that nature that kind of weakens the mucus and also lowers the or neutralizes the pH, and then so that the bacteria can go into the stomach and infect the area. So that's generally how it works. And we're going to talk about specifically how the medications can help prevent this from occurring and further exacerbating this or worsening this infection as well. So typically, like I said, there's these different routes in which H. pylori can occur. And I mentioned like the oral to oral transmission, fecal to oral, gastro to oral transmission. You might notice maybe these type of things while you're in practice or when you're around in places. It's important to know that this bacteria can be caused by different types of routes. So like it can be also through water ingestion as well. So you might have a patient case and they might have one of these types of causes listed, and you might have to identify what might be leading to that event or what might cause it. And obviously, H. pylori is going to be the one. So, kind of understand that, and also noticing that in order for it to go inside, you need to produce urease. Urease needs to convert to ammonia and then neutralize the stomach acid so that the bug can get inside the stomach and cause ulcers. So, just another information here so that you know how it can kind of do its work in the body. Um, so let me show you the treatments here. So in the early times, they used to use the classical therapy, which is typically a triple regimen here, consisting of a PPI or proton pump inhibitor, like omeprazole, esomeprazole, those kinds of things. And then they add clarithromycin and amoxicillin or metronidazole. So that would be your triple regimen. And that's what people thought it was going to work for, preventing H. pylori infection. But then later on, there was some study that showed that there was some resistance against the clarithromycin or like macrolide resistance. So they looked more into this. There was more studies conducted, and it showed that bismuth quadruple therapy was a preferred first-line agent in this case because it would actually prevent more of the clarithromycin, particularly bypassing the resistance of clarithromycin. So having this quadruple therapy regimen is actually a preferred first-line therapy, and especially could be used as a way to use as a backup. I guess you could say second line for someone who is already on triple regimen with clarithromycin and it's not working for them, then they use this quadruple therapy to take care of it. And so in this quadruple therapy, in all of these, you'll pretty much have a PPI no matter what. You'll start out with a PPI and then you'll have at least 2 antibiotics to help with it. So here you have PPI, tetracycline, metronidazole, bismuth, and that therapy will typically occur between 10 to 14 days, usually 14 days. And that's typically the first line therapy. Now, there have been other studies too where you would do sequential therapy with one antibiotic and one PPI, which is PPI and amoxicillin for first 5 days, and then you would do PPI, clarithromycin, amoxicillin for 5 days. So that would be like a 10-day treatment. And then there was non-bismuth quadruple therapy. It just, I guess, in a way, if patients aren't able to take bismuth, then this will be another alternative. The only difference is there will probably be a large number of pills that they'll have to take. That's the disadvantage here. But it would consist of someone taking PPI, clarithromycin, amoxicillin, metronidazole for 10 days. So basically 3 antibiotics and a PPI in this case. And then hybrid therapy is where you would take a PPI and amoxicillin for first 7 days, and then PPI plus amoxicillin plus clarithromycin plus metronidazole for the remaining 7 days. So that's another option there. And then the last one I want to talk to you about is the levofloxacin-based therapy. Now, this isn't very commonly used. It's just used as a substitute for clarithromycin in triple or sequential regimen. So um, in this case, it will help, but only after failure of clarithromycin and metronidazole therapy is used. And also, it's not commonly used at first line because of the resistance that has been developed because of its use in mainly other types of infection like urinary infections. So that's basically how these treatments are done. But on an exam, you might want to, if you were to give in a case, and you would probably want to look at where they have like the resistance to clarithromycin or macrolide resistance, and choose an option that doesn't have a macrolide in that group of regimen. So you would pick like the best answer for that. And you might not have very many questions on this, but if you do, at least you have an idea as to what type of antibiotics you would be using. But when you look at this next one here, this will probably kind of give you an idea as what type of antibiotics are used to help treat H. pylori infections. You can see here in the diagram, right in the orange inside the bacteria itself. Let me point it out here real quick. So like right here, this is your ribosome, okay, which is divided into the 50S and the 30S. And what happens is there are antibiotics that you would typically see for treating like the H. pylori infection. You might see clarithromycin, macrolides. Macrolides like Big Mac or like the 50S. That's going to be the 50S ribosome. That's where it's going to work against in protein synthesis. And then the other one is tetracycline. Tetra like 330. It's the 30S. So it's going to work against the or it's going to work against the protein synthesis that occur in the 30S ribosome. So inside the H. pylori, you have these ribosome groups where the antibiotics will work against. And then you have here in the blue is the cell wall. And the cell wall is where this antibiotic will work against, which is the penicillin type of drug, which is amoxicillin. So amoxicillin will work in that group here. Okay, and amoxicillin is going to basically disrupt the cell wall synthesis. So it's not going to let the bacteria have a very strong cell wall. And that's how, that's basically what's happening here. You can see the squiggly red lines indicating like it's kind of breaking up the cell wall. So it's kind of breaking up that bacteria or weakening it. Then metronidazole, that's going to work directly against the DNA form of an anaerobic bacteria. So just note that metronidazole is working the anaerobic bacteria. So that's one thing to note here, especially. And one other thing with metronidazole, you never want to take it with any alcohol. That is a counseling point. You guys should all know about that. And just to also note that anytime an antibiotic is taken, there is going to be some sort of side effects. A patient may still experience side effects like nausea, vomiting, diarrhea with any antibiotic, even having gastrointestinal infection. But if it's occurring with the antibiotic, they have to still finish the antibiotic. They should still continue with the antibiotic until it's completed, so that the therapy is finished, and then that they can it will reduce the infection further. And then there's another medication here, the PPIs. The PPI is essentially going to block the H plus or the proton and the potassium ATPase transporter. And that's so, it can kind of neutralize the acidity in the stomach so that the antibiotics can work within that part of the stomach area. So it's going to kind of neutralize the pH in there. The antibiotics will start to take effect, and then it will kind of work against the bacteria that's presented there. So PPIs are essentially like neutralizing the pH. So, and one other thing I want to note here is the bismuth. The bismuth is especially used to kind of coat the mucous lining of the stomach, so it can act as like a protective layer and prevent various infections from entering the cell. Specifically, like you said, the parietal cell, which is one of the stomach cells in that area. And it also works, it's like a secret weapon, so it actually kind of also works against the cell wall of that bacteria. So it's kind of break up the cell wall as well, kind of disrupt it from synthesizing. And it also prevents the adhesion of the H. pylori as well to bind or to get it inside, to allow it to get inside the stomach area as well. So in a way, when you have a quadruple regimen, it will prevent all of these kinds of infections. So it's kind of interesting to see how the medications can help prevent this type of bacterial infection. So just take a look at this, and you can try and redraw it if you need to, but it's just so you see a big picture of how the infection is prevented through these antibiotics. Now, there's one other thing that patients might take, like I'm sure some of you have seen it in practice or have seen it in the store, like Florigen products, probiotics, like that contain lactobacillus or antimicrobial organisms. So these also have, in the studies I've read online or during my research here, it showed that they have some mechanisms that work against H. pylori as well. So one of them is that they can compete against the H. pylori in getting those adhesion receptors. So if you saw here in the first diagram here, in the very first slide here, you saw that H. pylori, you see the binding of the adhesion molecules. So just like that, if you have a probiotic or Florigen, it's going to kind of compete against it and prevent the binding of that H. pylori from binding to those adhesion structures. So that's one of the mechanisms of like a probiotic generally. So it can stimulate that mucin production, then also strengthen the mucosal barrier of the gut. And also it releases one other thing, like short fatty acid chain. So it kind of makes the the outer part more acidic. So like the bacterial infection caused by H. pylori it's going to reduce its effectiveness from infecting the area that needs to. So basically the short fatty acid chains are going to reduce that pH or make it more acidic. So it can prevent that H. pylori from getting inside the stomach area and causing all sorts of problems there. And so it's shown to also cause inhibition of urease activity in the H. pylori. So it can't really neutralize the stomach acid. And there's a link here. You can go into it. You can find in PubMed that talks a little more about this and all the other medications we discussed earlier. And that's pretty much it. I don't really have anything more about this other than the fact that, just know some important counseling points on these things, especially if patients are on other medications, not just for this, but they might have some other chronic disease states, understanding metronidazole, what you should not take it with, which is alcohol, amoxicillin, tetracyclines, that might lead to some kind of discoloration in like the teeth and things like that, macrolides, and knowing the interaction with certain other types of medications patients might be on, especially when it's heart-related medication, and to prevent like QT prolongation and those kinds of things. So not just understanding the mechanism and how it works as H. pylori, but also understanding how it kind of interferes with other medications that patient is having as well. But for the purposes of this lecture, I just wanted to briefly talk to you about the upper GI tract, just for your information purposes. So that's pretty much it. And if you have any other questions, feel free to let me know. You can ask here, you can ask on my channel. Feel free to comment. And if you would like to watch more videos, feel free to subscribe, and I'll keep you updated with more information as they come. And that's pretty much it. Thank you for all watching. Thank you for watching this video. Thanks.